Now for some key knowledge. Have you revised this topic yet? Key vocabulary. When talking about fertility, 3 key terms to keep in mind. LH. LH is a hormone that triggers ovulation. FSH. This is a hormone that causes an egg to mature in an ovary and stimulates the release of estrogen. And finally, IVF, in vitro fertilization, bringing the sperm and egg together to produce an embryo. The key points to IVF are as follows. FSH and LH are administered to stimulate the follicles to produce eggs. The eggs are then collected from the mother and fertilised by the sperm from the father in the laboratory. The fertilised eggs develop. The embryos that develop are then used and inserted into the female's or the mother's uterus. Evaluating IVF. In vitro fertilisation has both its advantages and its disadvantages, and you may get asked about these. Firstly, the advantages. IVF has a safe track record, and it allows people to have their own babies. Unused eggs can also be used for research. However, there are disadvantages, and these disadvantages can possibly outweigh the advantages. The disadvantages are as follows. IVF may cause ovarian hyperstimulation syndrome, and this could be dangerous to the mother. Again, another danger to the mother is the possibility of multiple births. As the mother is having IVF, she will also have drugs to help her through the course. Side effects from the drugs can also be an effect. And finally, IVF is known to be very emotionally and physically stressful. Time for a question? Worked example 1. Female reproductive hormones are used to treat infertility in women. Follicle stimulating hormone FSH and then luteinizing hormone LH can be injected into a woman to help her become pregnant by sexual intercourse. Explain how injecting FSH and then LH will help a woman to become pregnant. So obviously we need to talk about FSH, then LH, and suggest why this is important. So FSH stimulates eggs to mature. LH stimulates ovulation. And then this will mean if we're getting eggs maturing and ovulation being stimulated, more eggs to be potentially fertilized by sperm. Now let's take a look at the GCSE mark scheme and see how I've done. So first mark for FSH causes eggs to mature, LH causes ovulation. Slightly different answer to what I've put for my third point. More eggs present, higher chance of fertilization. more eggs, therefore higher chance of sperm fusing with an egg. Definitely scored 2 out of 3. Maybe my language needed to be better for the 3rd mark. Worked example 2. In some women, the injections of FSH and LH are the first steps in vitro fertilisation, IVF. Describe the remaining steps in IVF. So we know that FSH and LH from previous discussion cause eggs to be released. So number 1, we need to collect those eggs. Eggs collected from ovary. Remember, bullet points, nice and short. 2, these eggs are fertilised outside the body. Eggs are fertilised. And these eggs will then be allowed to develop into embryos. These embryos then need to be put back into the female, and we need to be a bit more specific than that. So embryos inserted into the uterus where they can then develop. So we've got a 4 mark answer, and I've put 4 concise bullet points. What we need to do now is check against the GCSE mark scheme. So here's the GCSE mark scheme. As you can see, concise bullet points. Talks about collection of the eggs from the ovary. They are then fertilised, develop into embryos. Remember, if they are words in a bracket on a mark scheme, those words aren't necessary. And then finally, the embryo is inserted into the uterus. Mark's been given to find number of moles. 4 out of 4, I would say, for that one. Mark's been given to find the mass of the iron. Give an answer. And the final mark. Now time for a practice question. Converting it into milligrams. Hormones are used in IVF treatment. Explain how different hormones are used to help a woman become pregnant. We've got 3 marks. We would require 3 bullet points. Pause the video and have a go at this question. So here's the GCSE mark scheme. How did you get on? FSH is given to stimulate the maturation of eggs. LH stimulates ovulation. Okay, this means more eggs and more chance of fertilisation occurring. Practice 2. In vitro fertilisation, IVF treatment, can be used to help women become pregnant. IVF uses some of the hormones shown in the figure above. This figure is to the side. Explain why IVF increases the chance of some women becoming pregnant. So we've got to use the graph, and then because it's an explain question, we've got to say why. Okay, so these hormones are used because. Pause the video and have a go. Okay, let's see how we've done. This was a 6 mark question. We want to be scoring a level 3 answer, 5 to 6 marks. Okay, so for 5 to 6 marks, we need a detailed, coherent explanation given. Logically links the role of different hormones to their use in IVF, and a clear explanation of how IVF increases the chance of a successful pregnancy. The points that should have been included in your answer are to the right. You should have identified the hormones, FSH and LH, they're always the 2 that appear. State what FSH and LH do. And then finally, what is the effect on the chance of a successful pregnancy. So, for example, high levels of these hormones causes eggs to mature and be released. Look at your answer and give yourself a score out of 6.